Our next wrapping is going to be for the hamstring strain. Again, we want to make sure that we use a double elastic wrap. Again, either 4-inch or a 6-inch. We also want to make sure that we have our heel lift. With this one, what we want them to do is just kind of stride and bring the uninjured leg forward while you put your heel on a heel lift with the knee slightly flexed. Okay. Most of the weight is going to be on the uninjured, in this case his left side. Next thing we want to make sure is that we have the patient down in elastic shorts, jock or underwear as close to the skin as possible. When applying this, we want to apply our Tough Skin athletic spray. Once that's applied, we want to make sure that if we are wrapping for a medial strain, we want to start the wrap pulling in the lateral direction. If we're treating for a lateral hamstring strain, then we want to pull to the medial side. So it's depending on what side the hamstring you're treating is the opposite direction. You want to pull the elastic wrap. Okay. So we'll say that we have a lateral hamstring strain. Again, we're going to have the patient hold the wrap for us if he's got a good hand. And another thing you want to make sure that you ask is, how far down the strain is, because you always want to cover the whole injury. If you need to go all the way down just above the knee, that's fine. If not, you can keep it mid hamstring. So we're going to pull it around once. After we have the elastic wrap around once, we're going to fold it over. Again, asking the athlete to hold on to that while we are, again, pulling medially with the wrap. Again, our elastic wrap is going to be pulled at about 75% of its elasticity. We want to go back to the groin area and then up around the waist again. And then once you go back to the thigh, again we want to go back down to the bottom and work our way up, overlapping about 50% or so each time, depending on how much wrap you have. You always want to finish on the hamstring. Again, have him hold that. Again, you can use the elastic tape. Again, 2-inch, 3-inch elastic tape, whatever you have. If you need to go around the thigh a couple times, you can do that. If you need to go around the waist. You always want to make sure that you finish on the thigh or hamstring area. If you use the white tape, you want to make sure that, again, that they're contracting their quadricep when you apply this. And you can put a little tab or a fold at the end of the tape so that you know where to find it at the end. If you need to put a couple of these, you can put those on if you need to. Check for effectiveness, if it's preventing the correct relief. You also want to check pulse, distal pulse and sensation to the area to make sure it's not too tight. That's it.